Hello, my name is Dr. Leon McDougall, the 121st President of the National Medical Association. Welcome to the National Medical Association Professional Development Series in collaboration with the Congressional Black Caucus Foundation. Our topic today will be social determinants of health, criminal justice reform, and abolishing capital punishment. I am so pleased to welcome our honored guest speaker today, Congresswoman Sheila Jackson Lee. She is an influential and forceful voice in Washington. She is serving in her 13th term as a member of the United States House of Representatives. She represents the 18th Congressional District of Texas, centered in Houston, which is the energy capital of the world, considered by many as the voice of reason. She is dedicated to upholding the constitutional rights of all people. She sits on 3 congressional committees, a senior member of the House Committee on the Judiciary and Homeland Security, and appointed by the leadership as a member of the crucial Budget Committee. So let's welcome Congresswoman Sheila Jackson Lee.
Thank you so very much, Dr. McDougall. What a pleasure to be with all of you in the National Medical Association. Thank you for the association's outstanding leadership in determining and improving the health of African Americans and many, many others. Thank you to the president of the NBA, C.K. Hopler, for your leadership in questions of justice and empowerment, and certainly to the lead medical officer in the District of Columbia, Dr. Roger Mitchell. What an important session involving, of course, the idea of criminal justice and health, certainly the question of abolishing the death penalty, and the vital, significant George Floyd Justice and Policing Act. I might say that the George Floyd Justice and Policing Act represents another major milestone of significance as it relates to civil rights and civil liberties and the saving of lives in our community. Many of us are reminded of the major civil rights legislation of the past, the 1964 Civil Rights Act, and of course, the 1965 Voting Rights Act. And our beloved John Robert Lewis, who passed just recently, was described as someone who was willing to risk his life for justice. Since that time, we have seen the loss of life and the lack of justice. There's been a long litany of violent acts at the hands of law enforcement that have seen many in our community lose their life. From the beginning of Amadou Diablo, and certainly Eric Garner, Walter Scott, Tamir Rice, many of those whose lives have been lost, Trayvon Martin under color of law, and now of recent knowledge, the heinous murder of George Floyd, the murder of Brianna Taylor, the murder of Ahmaud Arbery and Mr. Brooks in Atlanta, and many others who may have not been so named. Elijah McClain, a autistic, special needs young man that viciously lost his life. And so the effort of the George Floyd Justice and Policing Act is vital to your discussion today and to, I think, the issue of health, medicine, and justice. That bill was intended to be able to reimagine the relationship between police and community, was intended to lift up the civil rights of individuals and to stop the unnecessary actions of violence under color of law. This bill has been in the making for more than a decade, starting, as I said, with the killing of Amadou Diablo in the Bronx in New York in the 1990s, Sean Bell and others. And so we looked at it comprehensively and also to complement the issues of health. We wanted to stop the killings and the murders that were going on of men and women. I failed to mention Sandra Bland and Pamela Turner in Houston, Texas. Sandra Bland in Prairie View, Texas, lost their lives. This bill includes major legislation to, first of all, stop chokeholds completely across the nation, causing people to lose their life, just as we saw George Floyd say, "I can't breathe." It also is to stop the no-knock drug raid that was the basis of murdering Brianna Taylor. In addition, it is to realter something called qualified immunity, which means that the victim could never have a day in court because it would say that the city, the county, the state, and the officer could not be sued and would have absolute immunity from any charges. And most cases then were dismissed without any thought. A case that went all the way up to the Supreme Court, where the Supreme Court said the victim should at least have a trial, which was Robbie Tolan, who actually lived when the district court did not want to give a trial. They gave a trial, of course, but they used qualified immunity, and the case was dismissed as relates to the law enforcement officer that blatantly shot this young man. And so qualified immunity now has been altered so that the victim would have a chance in court and a determination could be made of the reckless behavior of an officer. We're allowing independent investigations so that when the local authorities do not move, the victims, again, will have some chance through a state proceeding or a federal proceeding, which is very, very important. We have statistics, or the gathering of statistics of the amount of killings that might occur at the hands of law enforcement. We end racial profiling, something that has generated altercations. Ahmaud Arbery was racially profiled. Trayvon Martin, racially profiled. These have caused severe consequences for our community. And then we have a major component of how do you be a police officer. There are 18,000 police departments in the nation, none of whom are required to be certified to say that they're following proper protocol. And that is, of course, to ensure that you don't use excessive force. This particular section of the bill, the Law Enforcement Trust and Integrity Act, defines the use of excessive force and prohibits such use, requires de-escalation. Tamir Rice was a little boy in a park. Why did police officers have to run upon him and shoot him immediately rather than de-escalating? And the same thing with the duty to act. The officers in George Floyd that watched him be murdered did nothing, and that has happened over and over again. It is crucial as well that we recognize the importance, as I said, of gathering statistics, but also pattern and practice. Determine the misbehavior of police departments so you can stop the killing or stop incidences or engage in, and when I say stop the killing in incidences of which we have just noted, because there is the opportunity to build good policing, reimagining policing, doing it in the mindset of those protesters, making it public safety. And part of that, of course, is something called consent decrees, pattern and practice. When you see this kind of behavior happening over and over again, it should be where they are forced to change. But if we start with the accrediting of all of these departments, if the training turns towards safety rather than the confrontational interaction with police, such that we don't have a circumstance of an elderly gentleman being knocked to the ground during the protests that we saw earlier this year. This legislation was intended, again, to reconstruct, rebuild, reimagine, change, and build up the dignity of those people of color who every day encounter actions, but really whoever encounters actions with individuals who are there to protect and serve. That's what the George Floyd Justice and Policing Act. Knowing the George Floyd family, let me quickly say, living here in Houston, growing up in CUNY homes in the 18th Congressional District, and of course, going to Jack Yates High School, this is but a small measure to bring back the life of their beautiful, beloved brother and father and relative. But the George Floyd Justice and Policing Act, I believe, is as much a partner to healthcare as any other civil rights initiative. And I would just say in closing that the dire conditions that we have found through the Innocence Project and independent review of the death penalty, the huge disparate impact it has had on African Americans, on Black Americans, on Brown Americans, on people of color is stark and dire. And the numbers are large in terms of the numbers of individuals who've been subject to the death penalty. Some few have been able to have their cases overturned by the major works of people like Bryan Stevenson, the Innocence Project, the National Bar Association, and many others. But it is not in any way a remedy to the ongoing, stark, dire statistics of high numbers of people of color, high numbers of Black Americans who've been subject to the death penalty, and after appeal, have not been able to get their case overturned. These are real issues of healthcare in our community. This is how people are lost. I would add as well, just quickly, that gun violence is unprecedented. Gun violence has taken the lives of innocent African Americans, and it is a health issue. And we have also managed to include the Centers for Disease Control, after decades of fighting, have been able to now have funding to look at the impact of gun violence in our communities. The George Floyd Justice and Policing Act is one measure to be able to stop, put a red stop sign up for what has been frighteningly the definition, if you will, of our lives in inner cities and rural areas, where more mothers and fathers have had to bury their sons and daughters at the hands of authority and under color of law. The George Floyd Justice and Policing Act was passed out of the United States House of Representatives, and tragically, the United States Senate has been an obstacle and obstruction to the work we're trying to do. But the support of the National Medical Association, National Bar Association, the leadership of Dr. Roger Mitchell and others will be a major component to ensuring that this significant bill that deals with life and death can ultimately become the law of the land.
Thank you, Congresswoman Sheila Jackson Lee, for that comprehensive, informative, and enlightening presentation. We are here to support passage of legislation that advances social justice.
Thank you so very much, and thank you for your leadership on this effort.
Now, let's continue with our programming, and just want to provide just a brief summary of what we'll be talking about here this afternoon, this morning, actually. This session, Social Determinants of Health, Criminal Justice Reform, and Abolishing Capital Punishment, will discuss the link between issues of social justice and health outcomes in the Black community. The session will explore how partnerships between leading organizations such as the National Medical Association and the National Bar Association can work to address these issues. Panelists will also discuss legislative efforts such as the George Floyd Justice and Policing Act of 2020, and will review National Medical Association efforts such as calling for a uniform reporting standard resulting from deaths in police custody, and calling for the abolishment of the death penalty. So our first speaker here today in this panel discussion will be C.K. Hoffler. If you could please back up to the next slide. Thank you for cueing me on this. So the title today, we incorporate social determinants of health because there are factors that influence health that aren't necessarily seen when a patient goes to the doctor, or we look at statistics and see the disparate health across our community. So I just want to share this with you from the healthypeople.gov website, and you'll see social determinants of health in the center. But also, if you look at the social and community context paradigm or circle in this diagram, it speaks to discrimination and incarceration. And if you go to neighborhood and built environment, it also speaks to the category of violence in our community, and police involved violence would be a part of that. So now I'm going to transition to our first panelist. If you can advance the slide. Attorney C.K. Hoffler is the president of the National Bar Association and CEO of the C.K. Hoffler firm, an Atlanta-based law firm that specializes in representing plaintiffs in trucking accidents, medical malpractice, wrongful death, catastrophic personal injury, civil rights litigation, commercial litigation, employment discrimination, opioid litigation, and global commercial transactions. Also want to point out that she is counsel to the civil rights icon, Reverend Jesse L. Jackson Sr., and has represented him and the Rainbow Push Coalition for the past 30 years. And I also want to point out in her biography, she speaks French, is proficient in Spanish and Portuguese. So without further ado, let's welcome President C.K. Hoffler.
Good morning. I just wanted to say a few words about our extraordinary moderator and the person convening this meeting, and that's Dr. Leon McDougall. Dr. McDougall is not only an extraordinary physician and an extraordinary leader, but he's an extraordinary person. I had occasion to work with him initially through a collaborative or a healthcare manifesto that the National Medical Association, Rainbow Push, and the National Bar Association, and then subsequently other organizations entered into surrounding COVID, and have been just extraordinarily impressed by his, not just, as I said, his acumen as a great physician and doctor in our community, but also his passion and his compassion. So Dr. McDougall, it's an honor to be here for this very, very important meeting, legislative meeting for the National Medical Association. I am honored to be on a panel with the legendary Congresswoman Sheila Jackson Lee, who gave us an extraordinary overview of where we stand on from a legislative standpoint on some of these important issues. I am also honored to join Dr. Mitchell in this panel, in this very, very important discussion. Social determinants of health. That's so critical to where we are today. So let me start by just saying a few things about the state of affairs in the United States and the impact on social determinants of health. As many of you know who have followed the areas I'm going to tackle this year, I believe we are living sadly in this country amidst 3 pandemics, not one, not just COVID-19. That is a pandemic that the National Medical Association knows all too well, because many of the 45,000 doctors that Dr. McDougall represents are on the front lines of the fight for COVID. There is a disinformation campaign, and it's to our doctors doctors and the African-American community, these talented, extraordinary doctors, to set the record straight. And they're doing that in our communities, not just treating some of our members in our community, some of the people on the front lines who have COVID, but also helping to educate our communities on COVID, on things that we need to do. So COVID-19 is the first one. The second is, in fact, the subject of today's seminar or panel, and that's police brutality, the need for policing reform and social justice. And the third, of course, is related, and that's election suppression, which I won't belabor, but I believe there are three pandemics. So in terms of the state of where we are here in the United States, we are in dire need for action, for people, for professionals such as doctors, such as lawyers, and just our community at large to take these pandemics seriously and to provide solutions, because we are being disproportionately impacted by police brutality. We know this, we see this, we live this. This has always been the case, but it has just come to the forefront in such a way, and it coalesced around the tragic death of George Floyd, Brianna Taylor, and so many others, that now there's a movement afoot through protests in this country to try to bring about reform, broad-based bipartisan support. But we know that the members of the Congressional Black Caucus have always been on the forefront of that struggle. So can we go to the next slide, please? Why do we need police reforms? This is George Floyd, and you can't quite see because it's such a devastating picture. The police officers or the police officer who has his foot on his neck, his knee on his neck, preventing him from breathing. He said he couldn't breathe, but yet that didn't stop a police officer and those who sat as spectators, other officers, from watching him die right then, right there. That's why we need police reform. But just so that everyone's clear, we've needed police reform for decades. As Congressman Sheila Jackson Lee said, this movement, what we are seeing now, the legislative efforts have been underway for at least a decade. Next slide. So the NBA's position, we support the efforts of the Congressional Black Caucus wholeheartedly, completely, and the efforts of the National Medical Association wholeheartedly and completely. And we're asking for more. Why do I say that? Well, I represent the interests of 66,000+ African-American and Black lawyers, judges, jurists, law professors in this country. It's an honor for me beyond all honors. And when I say that, when I talk about the position of the National Bar Association, we look at our coalition partners, such as the National Medical Association, and those who we support, such as the Congressional Black Caucus. When we talk about the state of affairs, we have to look at the George Floyd Justice and Policing Act. Congressman Sheila Jackson Lee gave us an overview. We know that in June of 2020, an effort led by the CBC, the Congressional Black Caucus, the House passed a bipartisan bill, which is the George Floyd Justice and Policing Act. This policing act, this act is bold, it's unprecedented, its reforms are designed to transform the culture of policing by curbing police brutality, ending racial profiling, increasing transparency and accountability as it saves lives. Next slide. So let's be more specific. And I think Congresswoman Jackson Lee also talked about this. It puts a ban on chokeholds. It stops the no-knock warrants. And so the chokeholds, we see this throughout the country, these cases. It ends qualified immunity. I'm not gonna review what Congresswoman Jackson Lee already reviewed. It combats racial profiling. It mandates data collection, including body cameras and dashboard cameras. The body cameras and dashboard cameras, my members who are at the forefront of this fight, Chris Stewart, Darrell Parks, Ben Crump, Lee Merritt, and Lonita Baker, all who are either part of the leadership of the NBA or part of our very, very active NBA, longstanding members. They have all said that that body camera, the dashboard, the mandate is critical in establishing new standards of policing. Next slide. Chris Stewart, I talked about, he's from Georgia. He's one of my children in the law. He trained at the Willie Gary law firm in Stewart, Florida when I was a partner there many years ago. He's also a past president of the Gate City Bar, We see Chris Stewart on television day in and day out, nationally, locally, internationally, fighting the fight on behalf of those families whose loved ones were victim of police brutality. Ben Crump, we saw probably first arise on the national and international scene with Trayvon Martin, but what you need to know is this past president of the National Bar Association was fighting the fight on behalf of those families long before Trayvon Martin. Darrell Parks also from Florida, also a past president of the National Bar Association, fighting the fight. We've seen him over the years, fighting this good fight for policing reform. Lee Merritt, Pennsylvania, New Jersey, he probably represents more people in this country, more families whose loved ones have been victims of police brutality. Lonita Baker in Kentucky, she is one of the lead counsel for Breonna Taylor. She's a vice president of the National Bar Association. There are so many more, but I focus on these courageous lawyers who are on the front lines because they're fighting the fight every single day. They understand the necessity for policing reform. They understand the destructive role that police unions can play. They understand what it is to be on the front lines, sometimes to the detriment of themselves, receiving death threats. These are our members of the National Bar Association. Next. The National Bar has an NBA police brutality task force. Former police chief, Clarence Williams, he's retired. He was a police chief for Riviera Beach, a distinguished law enforcement career for 40 years, actually more than 40 years. He's also a lawyer, a retired lawyer and retired law enforcement officer, the perfect marriage to help lead the NBA on what we feel is going to be the most dynamic, and which is the most dynamic police reforming effort or initiative of all lawyer organizations in this country and around the world. Darrell Parks, we mentioned Darrell Parks before, he's a past president of the NBA, represents a number of the families, has represented a number of the families. They are co-chairing this initiative, and of course, I'm leading this initiative as the president of the National Bar Association. Next. So when we talk, Dr. McDougall, about the role of the National Bar Association and policing reform, we are active. We're on the front lines. We are taking an aggressive role in our communities because we don't have the right not to. We've teamed up with the National Medical Association because you all are also taking a very proactive stance, and you feel, I don't want to put words in your mouth, but that you must do this in our communities. You've always been there, our extraordinary doctors. So it is an honor. It is a pleasure. It is a badge of distinction that we wear at the NBA to be in partnership with the National Medical Association, to be in partnership with the extraordinary Reverend Jesse Jackson Rainbow Push Coalition, and to be in partnership with, because this is how we perceive it, with the Congressional Black Caucus members and moving forward their agenda, because we take this seriously and we won't stop. We won't stop as lawyers of the National Bar until we see the change that needs to happen. Thank you.
Wonderful, wonderful, President C.K. Hoffler. I agree wholeheartedly with the sentiments expressed, especially for the collaboration and partnership our two organizations will undertake and strengthen over this next year. Now, our next speaker, Dr. Roger A. Mitchell, Jr., who is a forensic pathologist who serves as the chief medical examiner of the nation's capital. And oh yes, I have breaking news. Breaking news. Today, he was appointed to serve as Deputy Mayor of Public Safety and Justice. We have a powerful panel here today. I'm just, what is going on? All right, so he is one of only 4 Black chief medical examiners of a major city in the United States. Dr. Mitchell is an expert in violence as a public health issue. He has been bringing attention to the issue of firearm violence in the African American community for over a decade and serves as chair of the task force on gun violence for the National Medical Association. And lastly, he recently co-authored a position paper on the violence epidemic in the African American community for the Journal of the National Medical Association. So let's welcome Deputy Mayor Dr. Roger A. Mitchell, Jr.
Thank you, Dr. McDougall. I appreciate it. President C.K. Hoffler, what a great opportunity is for me to be here with you, Representative Sheila Jackson Lee. It's great to see you again. I spent some time in Houston, Harris County at that medical examiner's office where I ran all death investigations for Harris County back in 2007 to 2011. So Houston is very dear to my heart. I'm going to continue on with what Dr. McDougall and President Hoffler have spoken about as it relates to the importance of legislation, but the importance of understanding this epidemic of violence, particularly deaths in custody, and give us some tools to be able to advocate for. I have no disclosures, and my opinions are not the opinions of the DC government. So let me start by saying that we did write this paper, and as you can see, we are in Black Lives Matter Plaza here in DC, and we're in as President Hoffler stated, we're in the midst of multiple pandemics at once. And so it's our responsibility as physicians and lawyers within our community to be able to solve these problems and advocate on behalf of our community. Next slide. We provided a position paper in 2017 that really is comprehensive, talks about violence against women within the African American community, as well as gun violence, as well as law enforcement force, and the importance of particular remedies, both legislative and practical, as it relates to law enforcement practices within this country. This paper is available to all of you that are participating in this webinar, and we want to make sure that you have access to it as you develop your own personal advocacy portfolios to move this effort forward. Next slide. I would be remiss if we're talking about social determinants of health and we're talking about the things that make equity extremely important within our communities. I would be remiss if we didn't call out institutional racism. Stokely Carmichael, who is a graduate of Howard University, we know that Howard University is a hot university at this point in time with high-profile individuals coming from Howard University. I'm a proud graduate of Howard University myself. But Stokely Carmichael said it this way: when white terrorism bomb a Black church and kill 5 Black children, that's an act of individual racism. But in the same city, 500 Black babies die each year because of the lack of proper food, shelter, and medical facilities, and 1,000 more are destroyed and maimed physically, emotionally, and intellectually because of conditions of poverty and discrimination in the Black community. That's a function of institutional racism. And that's functionally what we're talking about when we're talking about social determinants of health and the lack of equity. So Stokely understood social determinants of health even before it was vogue to define it as such. Next slide. Just to put it in perspective, why it's important for us to talk about deaths in custody and criminal justice reform in general. You can see 1 out of 9 men find themselves in jail or in prison, 1 out of 17 white men, but 1 out of 3 Black men. And this is extremely important, 1 out of 6 Latinx, but this is extremely important. And why do I take this personally? Well, I have 2 sons. I have a daughter and I have 2 sons. And so in my house, there are 3 Black men. So based upon these statistics, one of us is going to be connected with the criminal justice system in some way. I'm prepared to break the mold, and I know that many families are. And what I also want to point out is that even though these statistics look extremely discouraging, the reminder is that 2 out of 3 Black men are not being placed in jail or prison. So there's a 66% that are not. And even of that 1/3, some of that is based in institutional and structural racism that finds ourselves in connection with the criminal justice system. So if we're so connected to the criminal justice system, then we have to be thoughtful about the health and outcomes of those that are engaged in the criminal justice system. Next slide. So back in 2013, Bobby Scott put forward HR 1447, where it says states are encouraged to report to the Attorney General the information regarding deaths that are under the physical control or restraint of law enforcement, correctional officers, special police officers, or authorized employee or agent of a secure facility, youth residential facility, including those that are under arrest, in the process of being arrested or detained, in the process of being detained, incarcerated, or committed to any jail, any contract facility, correctional facility, including work release or mental hospital, or juvenilely committed to a secure facility, including youth residential facility. So point of advocacy. Right now, we do not have full compliance of the Deaths in Custody Reporting Act that was passed by both houses in 2013. And so there is an opportunity here for there to be full compliance with this Deaths in Custody Reporting Act. One of the issues that I find problematic is the lack of inclusion of the the lack of inclusion of physicians in reporting of deaths in custody. If people die from cardiovascular disease, it's found on the U.S. standard death certificate. If people are dying from motor vehicle collisions, it's found on the U.S. standard death certificate. If people are dying from cancer, and all of that public health information, those of us that are researchers go to the vital records where we find population statistics, and we utilize those population statistics to develop policy to decrease the morbidity and mortality of that particular disease or injury. As it stands now, there is no current way for public health providers to be able to go to the vital record and be able to identify those individuals that die in custody. And so it's for those reasons that the Medical Association, since 2017, has been requiring and requesting that the U.S. standard death certificate be a box be placed on the U.S. standard death certificate to record deaths in custody, so that the physician, whether it's that ICU physician, whether it's that emergency room physician, whether it's a physician like myself who's a forensic pathologist, it is our job to determine what those deaths are in custody, not law enforcement. Law enforcement do not certify deaths. Physicians certify deaths. And right now, we don't have the ability to bring notice to this epidemic. Next slide. So quickly, what are the phases in custody so you can understand that our depiction of deaths in custody is not a matter of establishing blame, although blame and responsibility and accountability may result from a certification of this death. It is not in and of itself established to assert blame. Next slide. So when we talk about the phases of deaths in custody, based upon what the law that we have in HR 1447 in 2013, is that the deaths in custody are separated into multiple phases, and excuse the typo there. Pre-custody phases, which are a pre-arrest related, and that's during apprehension or pursuit. In custody, which is temporary holding, restraint, transport, booking, intake, or holding. Incarceration, deaths that occur while in jail or in prison, and that's long status in prison. And then judicial executions, deaths purposefully conducted by the criminal justice system. So deaths in custody occur colleagues on a continuum. It occurs from when law enforcement is first engaged in chase all the way until someone is incarcerated for 20 years. And there may be different causes and manners of death that find themselves across this spectrum, including judicial executions. Next slide. So what are we asking for, and why is that standard death certificate checkbox important? Well, it establishes along the lines of phases. It results in reliable and reproducible data that members from the National Bar Association can query to understand how many people are dying from deaths in custody in that particular jurisdiction where they're attempting to adjudicate or find civil reparations for that particular cause. We have a national uniformity of certification. One of the big things with the George Floyd case that I've gotten questions on is, what did that cause and manner of death really mean, Dr. Mitchell? And so we have an opportunity to create uniformity of practice. An education model, a module formation that the National Medical Association is willing to be at the helm of establishing a module so that we can educate physicians on how to certify these cases properly. And then field development. We are at a paucity of individuals that have public health research and advocacy within violence and deaths in custody. Next slide. And so this is an example of the deaths in custody checkbox. Deaths in custody, yes, no, unknown. And where did I get it from? Well, we implemented it here in the District of Columbia. So we have an exemplar here in the District of Columbia. So if you're in any Department of Health or public health department in the nation, at the district, we can help you implement this checkbox. And if we create a groundswell in the particular states and jurisdictions, then we can leverage that for it to be placed on the entire U.S. standard death certificate. Next slide. And as we move forward, I just want to bring attention to this Abolish capital punishment resolution that was passed in this year's House of Delegates. Our President McDougal was just brought into his role as president, and I was able to follow him as secretary to the House of Delegates. Next slide. And there's particular points in this capital punishment abolition movement that we want all of you to join into. The bottom line is that capital punishment has impacted discriminatorily on people of color and poor. We know that African Americans comprise only 13%, but 42% of the people on death row. So I'm going to jump down to the bottom and let you know that the National Medical Association encourages professional organizations of health workers to work towards abolishing capital punishment and to discourage their members from participating in or contributing to the carrying out of the death penalty. And that's why this relationship with the National Bar Association is so extremely important. Because we coming together as an organization that have the interest of those that are most disenfranchised, we are a powerhouse. We can take on the National Rifle Association, and we can take on the capital punishment lobby groups. We are in the position as a nonprofit to bring information to our membership and bring it in a way that we can affect change. Next slide. So Representative Sheila Jackson Lee spoke briefly about this, because this is on a continuum of violence that's in our community. Next slide. We've been working on gun violence. We were on the Morning Joe talking about funding gun violence prevention research, and we're at the helm of putting pressure on the federal government to do that. Next line. And so we've done that, and we know that Congress reached a deal with the leadership of Representative Sheila Jackson Lee for the first time to fund research in decades. Next line. So we know that the work that we're doing across the National Medical Association, at the Gun Task Force, at its highest leadership, and throughout all of our affiliate chapters, is that we believe that gun violence is a public health issue, and we believe that deaths in custody is a public health issue, and we need to treat it as such. So I want to thank you again for this opportunity to speak today at this very important symposium, and I think we're now open to have any questions that may be provided to us. Thanks again.
Thank you, Dr. Mitchell. I just have a few questions. I'll start with President C.K. Hoffler. I was so impressed by the long line of leaders who have been involved with the National Bar Association, who are now on the front line nationally and nationally known for their work. President Hoffler, what would you say to up and coming African Americans who are thinking about becoming a lawyer or who are now in law school, and what role the National Bar Association plays and how they can become a part of that wonderful organization to join this effort, to join this activism? Could you, and perhaps maybe speak to your own story and how what we're talking about now may have encouraged you or others to be a part of this movement?
Absolutely. Well, thank you so much again, Dr. McDougall, for giving me the opportunity to address something that's near and dear to my heart. For those young folk, and law, whether you're a law student, whether you're in high school, whether you're in college, or whether you just feel like you want to be a lawyer and be involved in social justice, the first thing you should do is join the National Bar Association. It's free for anyone who is anything other than a practicing lawyer. It's free. So when you're in law school, BALSA is the Black Law Students Association. That's an automatic pipeline for us, for young lawyers. If you at all have any passion for activism, that's a place to start. This is an exciting time in our history. It's a tragic time in our history because of all the things that we've talked about, but it's an exciting time to step up, to stay woke, as y'all say, and to take your place as wanting to push and be involved in this movement. There's so many opportunities as young lawyers, as aspiring lawyers, or as young people who just want to be involved. I can just take a moment of personal privilege. For me, when I was growing up, I did have the benefit of having an older sibling, an older brother, who was a lawyer. He did criminal defense work. So I didn't really know so much about the civil part of the practice, and I knew I didn't want to do criminal defense work, but I did feel that everyone deserved to have his or her day in court. And as I observed Black people going and being chartered, going to jail for infractions that others who are non-African American did not go to jail for, I immediately sensed this sense of injustice, discrimination. You couldn't help but feel that if you were a 60s child like I was. My goodness, I can't believe I'm saying I was a 60s child, but I really was. And that sense of injustice, being called everything as a child, a monkey, the N-word. I grew up around the world, so we're at a time when people didn't know much about Black people. In Europe, where I grew up, Hitler had, you have to remember historically, Hitler had people in Europe believing that Black people had tails. So when I was 6, when a child pointed to me and called me and said to her mother, "Look at the little monkey," to a group of us young Black children, I was 6. It was shocking. And in the United States, people were using the N-word when they were referring to us. I kind of equated that to that. And at that point, when I was 6, just moving and going to school in outside of Geneva, Switzerland, we didn't speak French fluently at that moment because we had just arrived, but we knew what it was to have someone point at us and say something having to do with the color of our skin. So we kind of thought those were fighting words, but I digress. For me, just wanting to always be a voice for the voiceless. People in our community are voiceless. If we don't step up and represent those people who are incarcerated, protesting peacefully and being arrested, chartered off to jail because you're protesting peacefully, we have to step up and represent them. I remember years ago, I represented a young girl. She was 5 years old. Her name was Jaisha Scott. Jaisha Scott, y'all remember, in Pinellas County, Florida. She was a little girl who had a meltdown in school. She was 5, and the school officials put shackles on her hands, put handcuffs on her hands, and ultimately she was held in the back of a police car for 3.5 hours with shackles on her feet because she had a meltdown. I'm a mother of 2 boys. I know a little something about meltdowns with children. It happens to the best, to the least of these, to all kids. They have a meltdown, a temper tantrum. That's what she had, to be handcuffed and shackled and left in a police car for 3.5 hours without the ability to hug her mother, who was standing there helplessly, hopelessly. Yes, that shaped my desire to represent children, to represent our people, to represent those who have no voice, because it's not right. So when we see a George Floyd, when we see a Breonna Taylor, when we see that, Black lawyers, many of us feel this is our duty. So those on the front lines, we know what it is to represent those who have no voice, because but for our intervention, they would be part of the millions of unsung heroes who died or who were injured, irreparable injury to them psychologically, because no one was there. They didn't have access to representation. So for those of you who are interested, there's a need for you. There's a desire for you to be amongst our group of people who represent so many people who need representation in our community now more than ever, because the acts of violence and the discrimination are at an all-time high.
Okay. So we're getting towards the end, and I want to provide an opportunity. I'm going to continue this same line of questioning because we've given the audience, we've given you data. I want to provide an opportunity for Dr. Mitchell to speak to the heart because you're the deputy mayor now. You've been a leader at the National Medical Association since you first joined. And could you speak to why are you doing this? And perhaps speak to students, medical students, residents, in regards to what they should be thinking about as far as their career. And then maybe if you can throw in there, how do we advance the check the box in custody provision that you've been championing? I know that's a lot, but hey, we got about 5 minutes, so if you could share with us.
Thank you, Dr. McDougall. I think that one of the great, I think, travesties in medical education is that as physicians and medical students, we aren't taught the importance of advocacy and the importance of engaging and having a voice, as C.K. Hoffler states, a voice for the voiceless. And I think we learn how to advocate for our patient, individual patient, to our patient, and then to our colleagues to ensure that there's proper care given to our patient. But I think that one of the greatest things that we can do as physicians, particularly physicians of color, is to extend our advocacy into the entire population and entire community. Not giving up our single advocacy to the individual patient, but understanding that we are just as equipped as our legal colleagues to become astute to the policies that govern our community and put ourselves in position to impact those policies. So like you said, I'm the chief medical examiner here in DC, and now the interim deputy mayor for the district. But I think the most important title, if I were to even think about titles, is father and husband. So at the end of the day, I'm a father to 3 and a husband to my wife of 18 years. And you know, this is a particular time in our history that if there's going to be a point where our grandchildren and sometimes our children, depending on your age, or even your great grands are going to say, what were you doing in 2020 when more Black people were dying than anybody else from COVID. You're going to ask us, what were you doing when a knee was placed on an innocent man in the streets of Minnesota? What were you doing? Not just what you were saying or where were you, but the harder question is going to be, what were you doing? And I think that it's important for all of us to be willing to sacrifice what we think is normal, to be obedient to a call to do something. So this is bigger than any single panel, any virtual construct. It's bigger than any one personality. It's bigger than any position or title. This is really about the freedom of our people and ensuring that we're operating like our freedom is at risk when our health is at risk for whatever disease or injury that we suffer from. So the box on the U.S. standard death certificate is a really a small thing to do. It's very easy to do. Tobacco smoking, yes, no, is on the U.S. standard death certificate. Whether somebody was in a car accident, if they were a pedestrian or a driver, is on the death certificate. And you know the reason why those are on the death certificate? Because people were dying secondary to car accidents at a higher rate until they started putting on seatbelts. And nobody questioned the fact that that's where we got our data from. So we can understand, are people seatbelted? Are they drivers? Or are they passengers? The other reason for tobacco, big tobacco, there was a point where some people would say that smoking did not cause cancer. Imagine that. In 2020, could we actually say that without a roar of laughter in the room? We couldn't. And so the same thing with gun violence, to suggest that access or illegal access or even legal access to guns is not impacting fatal outcomes is a farce. And so we need to make sure that we're capturing this data in a way that's reliable and objective. And that happens on the U.S. standard death certificate. It happens when physicians are involved in policymaking. So again,
Dr.
the National
Mitchell.
Medical Association is awesome. And I'm just excited to be a part of this conversation.
Thank you. And we're going to welcome back Congresswoman Sheila Jackson Lee to close for us during this wonderful session.
Dr. McDougall, you are absolutely right. This was a stupendous session. And let me thank the brilliance of yourself and President Hoffler and, of course, Dr. Mitchell. I've never heard the combination coming through to the viewers as I've heard it today. I close with the reminder of the question that I asked Attorney General Barr, who's not a doctor, but I asked him about the question of institutional racism or systemic racism. And to my dismay, he was unable to acknowledge that that existed. As I've listened to the presentation and the recounting of the outstanding lawyers, the recounting of the work of the National Medical Association and the issue of social justice, I think we all know that institutional racism and systemic racism permeates the medical arena as well as the social legal justice arena. The access to healthcare, the access to justice is reflective of what we find in our society, and it is a sickness. And so I think what is important to take note of is that there are many more miles for us to travel, and that in order to have an overhaul, we have to listen to Dr. Mitchell's great work that he is doing. And I hope to take his work back to the United States Congress and to see it expanded, even on the legislation that we already have, death in custody, that the nuances that he has spoken of, the fact that so many local jurisdictions do not adhere to that reporting. And that is one of the questions on the federal level, where they are not reporting death in custody, even as the law exists. But to be able to see the different levels of how to pierce into the death certificate and to make sure that it is accurate so that we can have a real addressing of the social crisis that deals with how racism permeates into the lives of so many in our community. So as I started with John Robert Lewis, the boy from Troy, I think what we've heard today is that his final words on the day of his death, that with the expertise, we see that there is hope. And we also see that there is a need to continue to fight for freedom. And it permeates, again, our system. So as you recounted, the George Floyd Justice and Policing Act truly needs to be passed. And the idea of a new decency between police, public safety officers, and community, and a new method of saving lives is particularly crucial, so that a young future ETM, emergency tech, but also a future nurse did not have to have a life extinguished, and someone called Big Floyd, humble man, a big umbrella, who mentored many children, did not have to lose his life. So I think this has been a session that has opened our eyes, and I hope that we can collaborate legislatively to all three of you, that we can master some additional legislation that pinpoints, along with social justice advocacy, the saving of lives, as you have so eloquently spoke of. I think the message of the late John Lewis, hope, and the late Dr. Martin Luther King, why we can't wait, has been evidenced by your excellent work in this session.
Thank you, Congresswoman Sheila Jackson Lee. And that is the conclusion of our presentation. Stay tuned for our next Congressional Black Caucus Foundation and National Medical Association program. Thank you all. Bye.